My name is Dr. Me, fondly called Dr. Pen. I'm the medical director of the Richards Clinic. Today I bring to you some facts you might not know about arthritis. Arthritis, when we say arthritis is actually an umbrella name under which there are over 100 diseases, majority of them affecting the joint. Some affecting the muscles, the ligaments, and other connective tissues of the body. But among them all, some are common. And the commonest is the one known as osteoarthritis. This is the one that affects the mobile joints of the body, causing degeneration of the joints. Because it's so common, when we talk about arthritis, majority of the time we are referring to this type of arthritis. There is also rheumatoid arthritis, which is an autoimmune type of arthritis where the body is fighting against itself, destroying the structures of the joint. You also have juvenile rheumatoid arthritis, which affects children, fibromyalgia, and many of them. Or did you know that the neck pain you have, the chronic neck pain and the chronic lower back pain, is also an arthritis? Yes, it's arthritis because in these areas there are joints, like the facet joints of the spine. They can suffer arthritis. The degeneration of the discs is also part of arthritis. The spondylosis of the spine is also part of arthritis. So most times we confuse the knee osteoarthritis as only arthritis. No, every joint can suffer arthritis. It's just any chronic joint pain is known as arthritis. Some facts I will bring to you today. If you look at this graph, you can see that all ages suffer arthritis, one kind of arthritis or the other. Starting from infancy, 10 years, 20 years, but the more one ages, the more one is likely to suffer arthritis. So for the fact that the elder people suffer arthritis does not mean that arthritis is disease of old age. Arthritis is actually a disease which can affect any age group. Okay? It's also a fact that women suffer arthritis more than men. There are reasons for that, and that will be a topic for another lecture. If you overweight, you are 4 to 5 times more likely to suffer arthritis. Okay? So other factors that predispose one to arthritis is age, just as we mentioned. Yes, the older you are, the more likely you are to suffer arthritis. Obesity, just as we mentioned, when you are overweight, you watch it, because your weight is putting chronic pressure on your joints, and that joint can suffer arthritis. Then family history, if there's any family members, parents, siblings that have arthritis, you are more predisposed to suffer arthritis. Okay, so injury to the joint and overuse of the joint. Overuse comes with posture, the kind of work you do that can be mounting pressures on your joint chronically. So with time, the joint can go through stress and suffer arthritis. Okay? Arthritis is a wound inside the joint. You might not have known this. Most people think my problem is the pain in the joint. And I'll tell them, no. Your problem is actually what is causing the pain. The pain is a symptom of what is going on inside the joint. So, arthritis is a wound or degeneration progressively destroying the structures of the joints, like the ligaments, the cartilage, and the bone. So if you look at this image here, you can see that this joint is still healthy, but has started suffering arthritis with the thinning of the cartilage. So as time goes on, the cartilage becomes massively destroyed and it begins to affect the bone. And here it's terribly destroyed. So at this point, the person might start having deformity of such a joint. So if one does X-ray using the knee joint as a model, So here you can see this is a relatively healthy joint. This is the bone of the thigh and the bone of the leg, well separated by a space. In X-ray, the space represents the cartilage. The cartilage is still intact here. But when this cartilage develops a wound and begins to tear away, or what we call wear and tear, at a later point, you now find out that this bone and the other bone will now be hitting each other. This is the person that will tell you that the knee cracks when he or she walks or tries to climb the stairs and all that. Okay? Because the bones are rubbing on each other. So it's a wound that progressively gets worse. So the earlier the wound is taken care of, the faster it heals. So what happens in the knee also happens in the spine. Just as I mentioned earlier on, the spine, the bones from the neck down to the buttock. And the bones come in pieces, what we call the vertebrae, separated by the disc, which serves as shock absorber along the spine. So the disc, the outer part of the disc is known as annulus fibrosus, which is very thick and strong. The inner part is the nucleus pulposus, which is jelly, like a jelly, very soft. So that's why it can serve as a shock absorber. But if anything happens and the outer part cracks, the inner part begins to push out. So this is what we call bulge, disc bulge. But when it opens up, it herniates, it pushes outside. So at this point, the herniation begins to compress the nerve. That's when the person will tell you, I have neck pain that goes down my upper limb, my upper arm and down. At a point, I can't hold something again. At a point, as it gets worse, the hand is becoming weaker and all that. So what happens in the neck also happens in the lower back. The pain was initially at the lower back. Before I know it starts going down the buttock and back of the thigh, down the entire leg. That is the progression as the degeneration gets worse. Okay? So because of the degeneration of the disc. Now, very important thing, and which is where many people get it wrong. You may not know that all the drugs you have been taking for months and for years are not even helping at all. And why they are not helping? The reason why they are not helping is because these drugs do not heal the wound, or what we call the degeneration. They are called pain relief or pain relievers. What they do at most is to relieve the pain, and most times momentarily. The pain will come back again. Why? Because the wound inside the joint that is causing the pain is still there and even getting worse. So at a point, the painkillers will no longer work again, because the pain the wound generates becomes beyond what the painkillers can handle. Okay? So if you are taking medications, painkillers, supplements, all the drugs that advertise online and offline, which will not heal the wound, is a waste of time and money. So for one to heal the arthritis, you have to heal the wound. That's the bottom line. If you don't go home with anything from this lecture, go home with this point. If the wound inside your joint does not heal, the arthritis will not heal. If you are taking a treatment that's not targeted in healing the wound, it's a waste of time and money. So to heal the arthritis, heal the degeneration, or what we call heal the wound. And you ask, is there any treatment that can heal the wound? Yes. That treatment is called regenerative therapy or regenerative treatment. You learned earlier on, we said the wound is called degeneration. That's why arthritis is called degenerative disease of the joint. So to heal it, you need regenerative treatment or regenerative therapy. And what are the regenerative therapy? Are they available? Very much available. We thank God for advancement in medicine. So now we can talk about solution for arthritis. And one of the regenerative therapies is the platelet-rich plasma therapy. This is a treatment in which we take your blood, spin it in a machine, or what is a machine called centrifuge machine, to separate the blood in different segments. Then you collect the part of the blood that is called platelet. and that platelet is collected to the water part of the body that's known as plasma. So that plasma is rich in platelet cell. So why do we need platelet cell? Because platelet cells contain what is called growth factors. So when you inject it in the affected joint, the platelet cells will burst, releasing the growth factors, which will begin to regrow the damaged ligaments or cartilages. So by so doing, healing the wounded or the wound inside the joint. Okay, so another regenerative therapy is what is called ozone, or mixture of oxygen and ozone. In a cell that is degenerating, the environment of that cell or tissue is lacking in oxygen. For you to repair or heal that area, you have to concentrate that area with oxygen. So a mixture of oxygen and ozone, which is what I regard as active oxygen, is injected around the joint, and it saturates that place with oxygen, allowing the cells or the tissues around that place to have enough oxygen to begin to revive and metabolize their food. Okay, so the other one is called cold laser therapy. Cold laser therapy is a light therapy which uses a laser light with laser technology. Laser light is a light that is capable of penetrating deep inside the tissue. It's not infrared. Infrared works by warming up the area, encouraging blood flow. But this one works by knocking off a gas that is known as nitric oxide, which occupies or which is very rampant in an area that is degenerating. So when it knocks it off, it allows the oxygen injected or the ozone oxygen injected to be absorbed by the cell, and that cell will begin to revive again. And that's how they repair the joint. In our center here, we combine 3 of them to get a good result. Some people do singles, one or any of them, but we like to combine 3 of them because that gives very wonderful results. So, does arthritis have a solution now? You may not have known before, but today you know that the answer is yes. Arthritis has solution, but just like as happens in every illness, the stage at which you begin to apply the right treatment matters. So the earlier you start this treatment in the course of the arthritis, the better. Why? Because arthritis goes from stage 0 to stage 4. The more it advances, the worse it gets. The earlier you start this treatment at early stages like stage 0, stage 1, stage 2, you can get a permanent cure. Yes, it can heal the joints and restore the joint fully back to normal. But at later stages, you might not get the appropriate result. So some people come at stage 4 and we tell them the only thing you have to do is surgical intervention. This might no longer work. Okay? So thank you very much for your attention, as we will thank medical sciences for advancement in the treatment of arthritis, for letting us have this, and we have been using it to set a lot of people free from chronic joint pain. See you again in the next lecture.